I'm here with Shauna O'Connell, our representative in the State House from Taunton. Thank you for joining us here tonight.
Glad to be here, Alex.
I was just wondering your thoughts on this big event we are holding. We're talking about the Community Mental Health Act. Do you have any thoughts on that really big piece of legislation that JFK signed 50 years ago?
You know, I think it's great that you're having this event tonight to really bring some notice to the mental health system. That act is something that has really helped us move forward in the way we treat mental health patients and kind of take away the stigma and let us talk about it and keep people in their communities where they can recover the best that they can, be with their families, and start to be more productive members of their community. So I think it's been great for anyone with mental health problems and for the mental health system in general.
Right, yes, and you know, as you know, what we talk about throughout the night, just the long way we've come, of course, the long way we have to go still. What are your thoughts on kind of the current state of mental health? I mean, comparing to 50 years ago, obviously a huge difference, but
there is a huge difference in the way the care is delivered. And that's certainly a much better difference. I think, unfortunately, we still don't fund mental health the way that we should. And, you know, if you go to the emergency room and you have a broken arm, it gets fixed. But if you have a mental health problem, it's a little bit more difficult to get the treatment that you need. And that's something that we really have to work on. I do sit on the Mental Health and Substance Abuse Committee at the State House, so, you know, it's something that I'm very interested in and very close to the subject matter of the legislation that's coming through the State House.
Right, and I know that on the State House you guys are always working, and we're always hearing about the work you guys are doing to improve that and to make parity a real thing, where mental health is treated like any other health condition.
Yeah, and that's right. And you know, people have talked about it for many years, but we really need to act on it. And you know, it's my opinion that what resources we have, we need to spend those on the people that are most vulnerable, the people that really need our help the most. And we can do that in this state. We do have a lot of resources. Massachusetts is very generous, and the people with mental health problems, you know, need the care and treatment that everyone else gets.
Well, thank you very much for taking the time to join us. I know you have lots of people to talk to tonight. We appreciate that you came and sat down with us.
Well, it's been great to be here, and I'll tell you, I came last week to see the art exhibit that you had up, and it was so moving and so meaningful. I hope that people come to that every year you have it. I know I will, because it'll really bring a tear to your eye and get you in touch with how meaningful these recovery programs are.
Yes, thank you very much. I'm here with Representative Heroux from Attleboro. So we're here with a big event. We're celebrating the Community Mental Health Act. What are your thoughts on that piece of legislation that Kennedy signed so many years ago?
No, I think it was a really important and useful bit of legislation, particularly because mental health has, you know, back then it was just coming to the forefront of people's awareness as like a real condition, you know, like a real issue. People used to think, oh, just snap out of your depression, or people with schizophrenia were just crazy. But you know, when you're talking about putting a massive piece of legislation like the Community Health Act through, that was, you know, Community Mental Health Act, that really brought it to the, you know, front and center of everybody's, you know, attention, and really made it a real agenda issue.
Right.
So.
And it, obviously an amazing piece, you know, 50 years ago, but still, even today with all the changes that brought, we still clearly have a long way to go. Clearly, mental health is not treated the same way as any other health condition, diabetes, etc.
Exactly.
What are your thoughts on that, about the kind of the slow movement, it seems?
Well, there is a lot of work that needs to be done with both mental health parity in terms of insurance, making sure things are covered. That's something the legislature is taking up this year, and I believe it's Ruth Balzer who's taking the lead on that, and she's another rep from somewhere in the Boston area, I know that. But then there's also the bigger issue that I find is the issue of stigma attached to mental illness.
Sure.
There is a lot of stigma that still persists. as I was just saying a moment ago with depression, some people still think just snap out of it.
Yeah.
There's other folks who, don't realize that, nobody really chooses to be mentally ill or to have a mental illness. One of the big concerns I have is the manner in which we're demonizing people with mental illness in light of the recent shootings.
Right.
Because a lot of the shootings that have happened, the high-profile shootings, I should say, the high-profile shootings often happen with somebody who, had a history of mental illness of some sort. But these are isolated events. They're high-profile. They're not the representative. They're not the norm. And so what's happening is a lot of our new gun laws, the proposals are being drafted to address mental illness and keep the guns out of the hands of the mentally ill. But one of the things I always like to say is, who are the mentally ill? Who is it a woman with postpartum depression? Because that's technically counts. Is it somebody who had ADHD when they were a kid? Because we could count mental illness as something that is just in the DSM, which ADHD would fall under. Is it somebody with learning disability? Again, something in DSM classifies. Is it somebody successfully living with bipolar disorder, or successfully living with schizophrenia, somebody who's taken their medication and they're on a proper treatment curriculum? So the long and the short of it is, I think the NIMH estimates that about 45% of the population have mental illness at some point in their life, whether it's temporary or whether it's chronic and long-lasting. If that's the case, then immediately almost half the population are excluded from the Second Amendment, which is something that I don't think a lot of folks in the NRA probably have thought about. So that's, still a lot of work that needs to be done with educating the public and especially our policymakers, educating policymakers on what exactly are we talking about when we say mental illness. Are they really more likely to be violent than other folks? So there's a lot of work that needs to be done there.
Right, and the fact that you're here today is just showing the effort, and many representatives who are coming here tonight, the effort to show their support, show their understanding. And for every representative who comes to an event like this, we know that we have one more person who has a better understanding of all the things you just said, because it really is that lack of knowledge.
Yeah.
That's really the country as a whole, the world as a whole really struggles with. So we appreciate that.
Yeah, I sit on the Mental Health and Substance Abuse Committee here in Massachusetts, and we're one of the few states that actually have a Mental Health and Substance Abuse Committee. And there's a lot of, again, it's just often counted as something off on the side, but we decided in Massachusetts a number of years ago that it was a big enough issue to have its own committee, and I'm glad we do, because we stay busy with reviewing legislation there.
Yeah, I can't even imagine how much work you guys have to put into just moving even Massachusetts, which is supposed to be a progressive state, moving us a little closer to treating people with mental illness the same way as we treat anybody.
Yeah,
so
exactly.
I appreciate your work with that. So thank you for taking time to talk with me tonight.
Oh, it's my pleasure. Thanks for having
for
me.
being here.
Yeah, thank you so much for having me.
Great.
Good evening and welcome. My name is Bill Shea. I'm the President of Community Counseling of Bristol County, and we are pleased that you're all here this evening. Tonight we're here to mark the 50th anniversary of President Kennedy signing into law the Community Mental Health Act on October 31st, 1963. It was the last piece of legislation he signed before his untimely death. The act and other legislation of that period was both a blueprint for services, but I think more importantly, it set a broad and transformative message about mental health care. At the time, President Kennedy described the status of mental health care as, "The situation has been tolerated for too long. It has troubled our national conscience, but only as a problem too unpleasant to mention, easy to postpone, and despairing of solution. The time has come for a bold new approach." That new approach emphasized education, prevention, treatment, and recovery. This approach, as Kennedy described, sought a bold new approach where the cold mercy of custodial care would be replaced with the warmth of community. The mentally ill need no longer be alien from our affections or beyond the help of our community. In a special message to Congress that year, the idea was, and I quote, to quickly and successfully treat patients in their own communities and then return them to a useful role in society. It's worth noting that at the time Kennedy signed the bill, the average length of stay for someone with schizophrenia in the state hospital was 11 years. I think this idea of a useful place in society is particularly noteworthy and underscores just how visionary the act was. It embodies the concept of recovery, which would not be embraced, in my view, by the wider mental health professional community until decades later. To the extent that any part of this vision has been realized, it has been longer in coming than we might have imagined in 1963. Nonetheless, I do think in some measure our presence here tonight reflects just how compelling and inspiring that mission and vision remains. It is a vision we continue to strive to realize. I can think of no better way to commemorate this anniversary and to recognize our striving for that vision than in the words and experience of those who have found their own path to recovery. A number of courageous individuals have sat and taped videos of their recovery story for us and with us, and we'd like to show you 3 of those tonight. They're brief, they run 2 to 3 minutes, but I think their words far more accurately can convey just the depth and the vision that we mark here tonight. So if the magic of technology works, we have the first recovery story. This is Deborah's story of recovery.
When I first got the borderline personality diagnosis, it was not very pleasant. I just thought it was going to be a lifelong train wreck, you know, and people would say that there's a light at the end of the tunnel, and I didn't see one, you know. I didn't even know there was a tunnel at that point in time, you know. It just seemed like a life-ending sentence. I had some manic episodes. People think they're fun. I don't understand that because I didn't have any fun. I wanted somebody to shut my brain off when I was manic. So there were years that I just didn't want to be alive. You know, most of my life, I had only heard negative things about people with any type of mental illness. So I was very unhappy to have a couple of diagnoses. I was in a hospital, and I just didn't want to fight anymore, and I was tired. And a doctor gave me a choice. I could go to Taunton State, or I could, you know, make the recovery not an option and do what I had to do and get my life back. It wasn't until I got to Pathways and community counseling that I learned about the DBT, and that was a potential avenue for recovery. CCBC, just people here have been amazing. And you can actually tell when people care. And you can tell when somebody's doing a job. And nobody in that building was just doing a job. You know, they really wanted to know how you were. You know, they cared if you didn't have any place to go for a holiday. They taught you how to, basically how to speak up for yourself, how to take care of yourself, how to slow down, how to not be self-destructive. You do it to free yourself, you know, not for anybody else. And that's what changed everything, was letting it all go, you know. So it basically saved me. I graduated DBT. I lost the borderline diagnosis. With really hard work, determination, never giving up, I have a life that I couldn't have dreamed of 10 years ago. I love life today. I have peace today. I don't know how to put it. I'm just really at peace with everything. And I know how hard I've worked. And you have to work really hard. And I wouldn't give up what I have now for anything in the world, so.
Thank you, Deborah. We can't do the work we do here without lots of partners in state agencies, a lot of partners in local schools, a lot of partners in the healthcare industry. As a matter of fact, if some of our staff look a little tired this evening, it's not being up late for Red Sox games, and it's not the effort they put in getting ready here tonight, but several of our staff we're up till after 3 o'clock in the morning working on a proposal along with the City of Taunton, along with Stewart Healthcare, to try to bring some wellness and recovery funds to the community. So we have many partners. It's great to see so many of you here today, and we really appreciate the work you do with us. We also have a number of elected officials here in the local level and at the state level. I just wanted to be sure we acknowledge and introduce them. Shauna O'Connell, our state rep from Taunton. Is Shauna still here? Thank you. Wherever we invite Shauna, she shows up, and we're grateful. She was here for the opening of our art show just last week, and can also find her down at the Galleria presenting certificates to our community crisis intervention training in a local police force, and we appreciate everything she does. Representative Paul Heroux on the Mental Health and Substance Abuse Committee at the State House. He was here earlier. He just had to leave a few minutes ago for another engagement, but we appreciate his support. And if you read the Huffington Post, I still read papers the old-fashioned way. I hold them. But the Huffington Post does the online newspaper of distinction. Paul writes frequently on mental health issues and advocacy, and does a wonderful job, and we look forward to working with him some more as well. The second recovery story we have is Dennis. This is Dennis' story of recovery.
I probably went at least 10 years of my sobriety very depressed. And I think I shortchanged myself because I deserve to be happy. Being homeless 5 years ago, the people from the Bridge House who are affiliated with CCBC helped me find housing, asked me if I wanted to go to Pathways, and I said, no, I don't want to go there. I'm too good for that. Well, I thought, it's people that are dysfunctional, that don't do anything, and in reality, it's just people that have a mental illness. And I didn't think I belonged, but it's people that are working on building a better life. So I finally, after many hospitalizations, I'm not talking one or two, but many hospitalizations, I finally sought treatment. So my case manager, Ruth, when I got discharged, she said, well, Dennis, you got to go to Pathways. I mean, you just got out of the hospital, you got to do something with your life. So I said, okay, all right. I started attending Pathways almost 3 years ago, and it's the best thing that ever happened to me. I mean, the people over there are They're priceless.
What are some other goals that people have for themselves for 2013? Dennis?
To graduate from Pathways and to get a full-time job.
Okay. Now, do you think that both of those things are reasonable for you?
All very reasonable. They helped me with my depression. I started seeing a therapist, got on the right medication, and I go every day. I can't wait to get up in the morning and go there. Since I've been coming to Pathways, I haven't been depressed. That's been 3 years. I don't think I've had one day where I felt bad. It's just something about that place. It's magic. I just can't believe where my life is today. It just keeps getting better. It's unbelievable.
Thank you, Dennis. Of course, the magic is what clients bring to us and share their lives with us, often in the most difficult of circumstances. And the magic is what they bring and the courage they bring to address those issues and the commitment and effort that our staff put in. So that's the magic. As I noted earlier, we depend on the legislature for voting the budget and championing the issues so that we have the resources to meet the needs here in the community. We have with us one of our state legislators today who's a real champion of those who need our care. Pat Haddad. First met Pat in 2001 after she was elected to the legislature. I knew from her background and the small amount of research I did that education and children were important issues to her. So I called her up and introduced myself and said, there's a bill before the Committee on Substance Abuse and Mental Health that we really think would improve care to children. And I ask you if you would please write a letter in support of the bill. She said, Bill? No, I'm not going to write a letter. I want to go there and give testimony personally. Will you help me craft a response? From that day to this, she's been a champion and an advocate and been there every time we've needed her or asked her for anything. A couple weeks ago, I called Allison in her office, who's wonderful in her own right and keeps Pat's schedule somehow on track and moving forward. I called Allison. I said, Allison, I've got to talk to Pat today. There's something in the supplementary budget and the language I just have to talk to her about today. Any way you can arrange that for me? I'll get back to you, Phil. I said, okay. An hour or two later, Allison calls back and says, Phil, I suppose you've heard that they're closing the power plant in Somerset. Pat's on the phone with everybody. She's really busy, but she just wants you to know the language you favor is already in the bill. That's the kind of thoroughness and effort and organization that she brings to the legislature, and that's why she's a Speaker Pro Tem, and that's why we'd like to recognize what she has done and hopefully will continue to do. Pat is also co-chair of the Mental Health Advisory Committee, which will be issuing a report shortly about the adequacy of mental health services across the Commonwealth and what we might begin to do to improve on that. So I would ask Pat to please come up for a minute. Special Recognition Award. This award is presented to Representative Pat Haddad in recognition of your outstanding support and dedicated service on behalf of the many children, adults, and families in our community that experience serious emotional disturbance, mental illness, or addiction in their lives. Presented by Community Counseling of Bristol County, November 1st, 2013.
I just first of all want to say thank you, because while we are the ones who go to Boston and fight the good fight or bring the issues, we don't do this alone. If you were not there for us, if you were not, as I, tell Phil, give me the talking points, I'll be the person who gets out there in front and fights, but you are the ones who do the work. And there's not enough thank yous to say what we really feel about how hard you work, what you do for people in the community. So thank you isn't enough, but it's all I have right now. So again, my pleasure, my absolute pleasure.
Our third and final recovery story is Jason. This is Jason's recovery story.
Okay. I'm a recovering addict. My name is Jason, and this is my story. I don't forget that, towards the end, the last couple of years, how I wanted nothing more than to stop doing what I was doing, stop using drugs, and to get clean. I just didn't know how to do it. The first drug that I ever used was alcohol. It was probably in my high school years, and I just remember that by drinking, it took away the insecurities that I had, the anxiety issues that I had. It took me out of that. It took me out of that. Then I remember OxyContins came out, and it became a big deal once the physical addiction played a part in it. And it didn't take very long. The way opiates made me feel was, it did the same things for me that alcohol did, but in a much greater level, where I could really step outside myself and really be sociable with people, and it enabled me to work harder, because it took away the pain. Eventually I ended up getting married, had a daughter, and I remember that was like all I ever wanted was a family. Especially to have a child, have a daughter. It was an amazing thing for me. And but because I was wrapped up in an active opiate addiction, I always lied, because when I had to go and meet somebody, and it would always take longer than when it was supposed to. Things of that nature really just tore that marriage and tore my family apart. Didn't I love my wife enough, and didn't I love my daughter enough to stop doing what I was doing? Why couldn't I stop? I knew how much I loved them in my heart. I never forgave myself for what I did. And most of all, I really just truly hated myself. It got a lot worse. It switched over to being an IV drug user with heroin. And, they talk about doors being opened, and once that entered my life, the door got blown right off the hinges. It was my life just spiraled completely out of control. I remember I either wanted to get arrested, or I wanted to die. I couldn't do it on my own anymore. So I checked myself into a detox. I ended up taking advice from a counselor I had in there to further my treatment, and to move into a recovery house, sober house. And I remember being scared. I worked as an offshore fisherman, and it never scared me to be out there in the water.
Welcome to Smith House. We have 3 new gentlemen.
One of our biggest goals is to keep folks here as a family and to support each other. So that's important that you know that. Because it's not like one day you're in a place you're getting out, and the next day everything's fine. It's not. It's a lot of hard work.
My name is Jason. I was pretty much on my knees when I came in here, and was willing to do whatever people told me to do in order to just stay clean, because I just didn't want to use anymore. And coming here was probably the best decision that I've ever made in my life.
This house has given me back my life, you know. They say a grateful addict will never use again. And I always remind myself when times do get tough, the things that I am truly grateful for. And the house in CCBC, what they have given to me, it's amazing. I'm able to look in the mirror today and like the person that I see, knowing that as long as I keep doing what I'm doing, I'm gonna be all right. You know, life is life. Certain times in life, things aren't okay, but I know I'm gonna be okay. You know, and that's it's an amazing feeling. It truly is. And I know everything's gonna get better.
Thank you, Jason. I'd like, Deborah is not able to be with us tonight, but I would like to ask Dennis and Jason to come up and just so we could recognize them and give them a small memento. You know, all know Andy Dolly? There's this. There's a reason he's the chief operating officer, is to keep me on course when I get off course, which happens all too frequently. Andy reminds me that, as I mentioned, we have several videos to put on our website. We are actually in the process of hopefully producing some more, and we have one other person who we're not able to show his video tonight. After our program here, we'll be running all of the videos continuously in our training room. But Chris Devine, would you like to come up also, please? And thank you, Chris. Sure. We have a certificate of appreciation for each of them. Let me just read it and ask the representative and congressman to help me distribute them. This certificate of appreciation is awarded to Jason, Dennis, and Chris in recognition of your generosity and courage in assisting others in our community on their individual path to recovery. Presented by Community Counseling of Bristol County, November 1st. Thank you all. I just asked Jason if it would be all right if I passed on a piece of information. We filmed these last January between editing and other things. We took a while and received a very nice letter from Jason a few weeks ago. Again, continuing his path to recovery. He now helps us out at Smith House as kind of a trustee and support the program. But I was really touched when he let me know that he's reestablished a relationship with his daughter, and that's just going great. I prepared about a 40-minute presentation for tonight, but I've been editing it down to about 2 minutes. all week, but those of you in the management team, don't worry, you'll hear it all on Thursday. Since 1963, we've learned a great deal about mental illness and effective treatment. For all that we've learned, too often those who could benefit from this knowledge do not have meaningful access to the care and treatment that would make a difference in their lives. And again, this is part of what we're striving for and part of the vision which we're hoping to recapture and refocus on tonight. One of the exhibits we put together is back along the wall to my right. I say we put together, Michael and Becky put it together. It's a timeline of mental health care in the United States, focusing us particularly on Massachusetts, of course. I hope you get a chance to look at it. It doesn't take a very careful reading of that history to recognize that for over 250 years, the care of those with serious mental illness has seen any number of movements of well-intentioned, compassionate, thoughtful, progressive reform that often brings resources and real and meaningful change. It doesn't take much analysis either to recognize that these movements fade, diminish over time, attention wanes, resources erode or disappear, systems are overwhelmed, neglect and even abuse follows. While we treat about 12,000 children and adults throughout southeastern Massachusetts each year, our care does not reach all of those who need it. And many do reach, we're unable to address the extent of the needs that they bring to us. The vision that Kennedy established in 1963 remains as compelling as it is challenging. As all of us together to strive to bring us closer to realizing that vision, as Kennedy put it, that the mentally ill no longer need to be alien of our affection or beyond the help of our communities. I would think we would do well to recall the words of President Kennedy in a wholly different context when he said, "In short, we must face problems that do not lend themselves to easy, quick, or permanent solutions." We at CCBC look forward to continuing to work with you to strive to bring us closer to the vision and to allow us to face the problems that don't have quick, easy, or permanent solutions, and to bring the care to all of those in our community who need it. Thank you very much, and I would like to ask Pat if she would introduce our Congressman.
Thank you so much, and that's what I actually thought I was coming here to do tonight, to introduce the Congressman. So one of the things I did not say when I was saying thank you was, I don't do this work alone, and I work with an amazing team of other legislators, both from here at Bristol County and across the state. So the award that you've given me tonight has to be shared by my colleague, Representative O'Connell, Representative Heroux, and so many other people who find this is among the most important things that we can do for people. So I was taken back and I didn't properly recognize my colleagues. So let me tell you about my newest colleague. A young man whose name may be very familiar to everybody, but I'm not sure that you actually know that Congressman Kennedy is a wonderful person in his own right. You can read his biography that tells you about being an actual scholar. He has a degree in engineering and management. But the fact that he used that degree in the Peace Corps and not to, go right out into the big world where you can make money has to be part of what makes him such a good man. The fact that he cared so much about children, as young as he is, that he started a program of after-school care, which is something that is very near and dear to my heart, and one of the things that we in Massachusetts think is very important. But I've said this before, and a few people have also recognized this, he's an old soul. He understands long before he has the graying hair that we have, most of us have, that people matter, that what you do for people comes back many, many fold to make your life very full. And I predict that he will have a very full life because he is a person who recognizes that children are important, people with mental illness are important, and everyone here in Massachusetts is important and brings something incredible to the table. So it's my pleasure tonight to introduce our newest congressman, but another old soul among us, Congressman Joseph Kennedy.
Pat, Representative Haddad, thank you so much for that extraordinary introduction. You did it just like I wrote it, so thank you. You got an almost all truth. The non-graying hair part, I will take the compliment, although it's graying faster than I would like to admit. So yeah, joke was a little bit on you. I was the prop tonight. You were the honoree. So it's an honor for me to be here, Pat, and recognize obviously your extraordinary commitment to our Commonwealth, to our region, to our communities, and for your friendship, and most importantly to me, the example that you set for what public service is supposed to be all about. Always in touch with your constituents, always in touch with those who need it most. And it's a well-deserved and well-earned recognition tonight. So thank you, Pat, very, very much. Philip, congratulations on an absolutely extraordinary evening and a wonderful program. And before I begin, to Deborah and Dennis and Jason, thank you. Thank you for your extraordinary courage, for your grace, for your willingness to share your own incredibly compelling stories. And there's nothing that I can say here tonight that is going to in any way, anything but try to reinforce what you all so eloquently said on that screen. And if you ever needed, for me as somebody who is 10 months into their first term in elected office, to have your example of what legislation properly enacted can do for somebody in their time of need is extraordinary. So personally, I just want to thank each and every one of you for sharing that story this evening. So thank you very, very much. To everybody else gathered here this evening, and recognizing that those stories do not occur in a vacuum, but through your extraordinary care, your own sacrifice, your dedication to our community, thank you. Thank you for the honor of being here this evening, to inviting me, to letting me take part in a truly special celebration. 50 years ago, President John F. Kennedy signed into law a piece of legislation that radically altered this country's approach to mental health, highlighting an issue that had long been relegated to the quiet sidelines of our country's healthcare system. President Kennedy advocated a new approach where, as he described it, as you heard earlier, quote, reliance on the cold mercy of custodial isolation will be supplanted by the open warmth of community concern and capability. 5 decades later, we come together tonight in a room that literally overflows with warmth, with community concern, and with capability. CCBC and the advocates in this room embody a simple belief that inspired an American president to act, that we must take care of each other, and that we are better and stronger when we do. Today, our work continues as we fight for full inclusion and acceptance of those living in the shadow of mental illness and addiction. We have the tools and opportunity available to us that President Kennedy could barely have imagined. Inspired by his own fight, my cousin Patrick spent his time in Congress championing the Mental Health Parity and Addiction Equity Act to ensure that mental illness was never grounds for insurers to deny coverage or providers to deny care. And the Affordable Care Act, under siege daily by those who still believe that health care is to be a luxury rather than a right enjoyed by all, contains the single greatest advancement yet for bringing mental illness and addiction into the mainstream of our healthcare system. If fully implemented, 60 million Americans stand to gain access to mental health services that they did not have before. Now, as in 50 years ago, we look to government to build the framework that's required to ensure equal access to care. But we look to ourselves, to each other, and to our community to make those laws count. So I want to close then with a thank you. From the bottom of my heart and from a grateful country, thank you for everything that you have done to hold our system accountable. Thank you for never taking this progress for granted. Thank you for continuing to fight and to show the rest of us the way. Thank you for being the tireless champions of the better, brighter, kinder world that President Kennedy imagined. It is an honor to be your friend and partner and to share this evening with all of you. Thank you very, very much.
Thank you, that was powerful. We really can't say how much we appreciate your being here tonight to provide great meaning to this event. And we have a small memento of the event. We have President Kennedy signing the bill, signing the Community Mental Health Act 1963, presented to Congressman Joseph P. Kennedy III by Community Counseling of Bristol County. Thank you. It's been tough up here tonight, following those 3 stories and Joe Kennedy. Well, I better get off the stage quickly. I have a few thank yous. An evening like this doesn't happen without the work of a lot of people. We've had a committee working on this. Andy Dolly has been chairing our committee, and Deborah and Becky and everyone. They're listed in your program. Please take a look and please thank them. I want to thank our sponsors this evening. Our major sponsors include United Benefits, Percy Law Group, Eastern Wealth Management, and Bristol County Savings Bank. We have a number of other sponsors, and we are grateful and appreciative of their efforts here tonight. I want to thank Persistent Productions for their execution and direction of the videos. Megan Shea, one of the directors here, she is related. She's the other redhead in the group. She became a redhead sometime between the last time I saw her and this evening. I would like to thank our board of directors for the support they give me and holding me accountable. I'd like to thank the staff for the commitment and energy and inspiration they bring to me and all of us every day. Lastly, I'd like to thank the individuals and families that bring their concerns to us and allow us to enter their lives often at difficult and even desperate moments. For you, we are extremely grateful of what you bring and what you allow us to do in your lives. We look forward to striving to realize the vision and working to solve the problems of everyone in our community. Thank you all for being here. Enjoy the rest of the evening. Thank you.